Good afternoon. My name is Benie. I work for the Center for Disease Control and Prevention in the Division of Vital Statistics. Today I'm going to present with Adam Holmes from MITRE and Myung Choi from Georgia Tech Research Institute. The topic of our presentation is Modernizing the National Vital Statistics System using HL7 FHIR. Before I dive into the mortality data flow, let me quickly talk about the problem with the current system. Vital event reporting includes demographic, medical, and geographic data, which derived from birth certificates, death certificates, and fetal death reports. The current process of capturing vital records information is duplicative, labor-intensive, costly, and prone to error. It also results in issues with timeliness of data submission and can adversely affect the quality and usefulness of the data. Mortality data flow for the current system. As you can see here, the state receives the data from the physician, from the medical examiners, as well as from the funeral home directors, and the state send the data received to NCHS. NCHS process the data received from the state and send back to the state a coded response file. The format used in the data exchange between both systems is IGE format, interjurisdictional data exchange. Now let's talk about the mortality data flow for the proposed system. Mortality data flow for the proposed system. Both the current system and the proposed system are identical in respect to the data flow. However, we can see that they are different when it comes down to the data exchange format. The proposed system is using HL7 FHIR between the various systems to exchange data. Now, let's talk about HL7 FHIR data standard death reporting. A lot of work has been done toward implementing HL7 FHIR. One example is the HL7 FHIR data standard death reporting, and the scope of the VRDR FHIR IG is to report incident of death by state to NCHS. However, please keep in mind that while the scope of this IG is limited to death reporting by state register to NCHS, the FHIR resource profile have been designed with the intent to be reused by other data flow. At this point, I'm going to turn in to Adams for him to talk about this section. Thank you.
Following the Vital Records Death Reporting Implementation Guide passing the May 2019 ballot cycle, we tested out the implementation guide using multiple scenarios at the September 2019 HL7 FHIR Connectathon in Atlanta, Georgia. Multiple states and their vendors were present, as well as CDC's National Center for Health Statistics, and also a Steve 2.0 developer. Steve 2.0 is a messaging platform. It stands for the State and Territorial Exchange of Vital Events, and that is a system operated by NVSS, which is the National Association for Public Health Statistics and Information Systems. So as I mentioned, we tested a few different flows. The first was state to NCHS. So that is mortality records flowing to NCHS with uncoded cause of death information. That flow happened over Steve 2.0. We also tested the return of that, so NCHS back to state, and that included the coded cause of death information. That also happened over Steve 2.0. We also tested direct state-to-state transmission, so the interjurisdictional exchange of mortality records. That was tested via direct transmission as well as through Steve 2.0. We also tested state to cancer registry, and that was a direct transmission.
To help facilitate testing the implementations of the Vital Records Death Reporting Implementation Guide, we developed the Canary testing framework. Canary includes various flows for testing, including testing a system's ability to produce FHIR death records, testing a system's ability to consume FHIR death records, corresponding round-trip tests to test a system's ability to convert between FHIR death records and the IGE mortality format, as well as a set of predefined FHIR death records that a user is tasked with entering into a system's user interface, and then Canary tests that system's ability to map their internal structure to the FHIR death record format. Canary also includes various tools that states and their vendors may find useful, including a tool to generate synthetic death records, a validator tool, a format converter tool, an inspector, and a creator. I'd like to note that Canary is open sourced under the Apache 2.0 license and is available on GitHub at github.com/nightingale-project.
To help the adoption of the Vital Records Death Reporting HL7 standard, we also developed the VRDR-.NET library, as seen here in GitHub. This repository includes .NET, specifically C# code for producing and consuming the VRDR HL7 FHIR standard, producing and consuming FHIR messages for the exchange of VRDR documents, support for converting VRDR FHIR records to and from the interjurisdictional exchange IJE mortality format, as well as a companion microservice for performing these conversions. I'd like to note that the Canary testing framework that I talked about previously is actually built on top of this. And like Canary, the VRDR.NET library is open sourced under the Apache 2.0 license and is available at github.com/nightingale-project. Now I'd like to hand it over to Dr. Byung Choi from GTRI to talk about testing with medical examiner coroner case management systems.
Thank you, Adam. We tested two scenarios at the 2019 HL7 FHIR Connectathon and the VRDR FHIR IH Implementers Workgroup meeting. One was for a case management system at the medical examiner and coroner's office to send the VRDR FHIR data to death registration system such as EDRS. And the other scenario was to get electronic lab report in FHIR from toxicology lab to case management system. In order to test producing VRDR FHIR data from CMS data and consuming the FHIR data at the death registration system, we developed a VRDR API service called IG Compass. The testing flow begins by creating JSON input data which contains the FHIR mapping for the CMS data. IG Compass uses the JSON input data to construct VRDR FHIR data and returns them as a response. CMS can then send the VRDR FHIR data to a death registration system or any other public health registration system. VRDR outputs from IG Compass were validated with Canary. For this test scenario, FileMaker-based CMS from UAB Medical Examiner and Coroner's Office was used to generate JSON input data. The VRDR FHIR data generated from IG Compass were sent to Genesis system. Interoperability module in the Genesis system consumed the VRDR FHIR data, which was then transported to Georgia Virtual Event Registration System. The toxicology lab reporting scenario was tested with NMS Lab and UAB Case Management System. Several API services were used to support this scenario. The workflow starts when a body arrives at the medical examiner's and coroner's office and a new case is opened. The new case is then registered at the Decision Index service. If toxicology lab is needed to be performed, a request is sent to a lab. The lab then sends electronic lab report using HL7 version 2 message. The ER receiver receives the message and converts that to FHIR data. Then, the FHIR data is stored for CMS to retrieve using death data pooler. The screenshots on the right side show that the testing CMS was able to populate its toxicology report section without human manual input. The software is available as open source at the public GitHub repository. Now, I'm handing over to Benie to talk about additional information about our work and conclude this presentation.
Thank you, Dr. Myung. This last slide shows the resources that were referenced during the presentation. At this time, we are open for questions.